specifically in relation to staff engagement for improving quality. Just to say that Roisin Breen normally welcomes everyone and says hello, but she's on leave this week, so you might bear with us. We have the expert of Naomi Palacios in the background who's helping us get this going, but this is relatively new to me, so just go gently with us, and do let us know as well if you've got questions or queries along the way, or equally if you've got suggestions from the work that you're doing within your own services. Um, just in terms of, I suppose, the chat today, when we talk about leadership for engagement, we're going to talk a little bit about what engagement is, what staff engagement is, why it matters, and what supports and resources are available to you, and some simple things that you can do to make a difference within your own organisation and with the quality improvement work that you're doing. With, I suppose, staff engagement, there can often be a perception that it is one of those things that's a tick box, or it's a nice to have, or it's the fluffy stuff, and people can be very cynical about it. We use this little clip here. We need more of what the management experts call employee engagement. I don't know the details, but it is something to do with people working harder for the same pay. And is anything different? How you actually lead, how you work with your teams. And in particular within a healthcare context, staff engagement is absolutely fundamental to improvement. If we're not having conversations with staff about the type of quality improvement we need within our system, or we're not having conversations with them about the type of contribution they can make to that, then we're really missing a huge part of that jigsaw, and we won't get the changes that we need within the system, which are really significant at the moment. We talk, I suppose, in terms of engagement. There's often, I suppose, a perception that engagement sits within HR function, and it's the sort of thing that happens as part of maybe your terms and conditions of employment. And there is that, and that is a really key part of it. But there is also, I suppose, specific skills that you can use to engage your colleagues in quality improvement. And that's what we want to talk about today. It's how do you get people into that space where they can make a full contribution to the team. And this is the definition. Some people will have seen this before. Some people that are part of the conversation today might actually have been part of the staff engagement forum, the National Staff Engagement Forum, that actually developed this definition. This is the definition we use for staff engagement. And it talks about staff feeling engaged when they feel valued, being emotionally connected, fully involved, enthusiastic, and committed to providing a good service, and that when they know that what they do and say matters and makes a difference. We'll talk a little bit more about this as we break it down later on, but in particular the piece about feeling emotionally connected. So that sense of purpose, that sense of contribution is key. And being fully involved in the conversation about the changes, knowing that what I do, no matter what my role is, that I have some contribution to make is key. There's that sort of acknowledgement that every person working within our system and within our health service is the professional at what they do, and that people's expertise and knowledge and insight can actually be much broader than the role that we see them working in. And that's one of the key things. When you look at any of the evidence around quality improvement or innovation, it'll tell you that the broader the team participating in terms of their skill set and their skills mix, you can often have huge insight into the organization, and much stronger ideas in terms of how you can actually really change things and make things work. So the more diverse the team is, the better. And that acknowledgement of what each of us can offer is absolutely key. I would say when we talk about why does it matter, it could ask that question, and realistically, I'd say that we'll all have different perceptions about why this actually matters. And when you look at the definition, we'll each have something there that will really resonate with us. Um, for people that are really interested in engagement in the literature, there's some really good research out there from Schiffelli and Bakker, and in particular, they would talk about vigor, absorption, and dedication as the three tenets of engagement. Now, most of the staff that we work with don't talk in terms of vigor, absorption, and dedication in their work. So this language is the type of language that resonates with people. And like I said, something in this will be different for everyone. And it can be really helpful to explore with your team What does engagement look like to them? So is it a conversation about the type of work we want to do? Is it, an opportunity for them to fully participate so that you can really understand what's important to the people that you're working with? We just started to talk about why engagement actually matters. This is some of the results from the National Staff Engagement Survey. It was Have Your Say, Your Opinion Counts 2018. This was led by the National HR team. The reason I suppose I want to share it today is there's two statistics in particular that I really want to draw attention to. One of them is that 69% of staff believed they were able to make suggestions to improve their work. And that would suggest that at least 30%, if not more, believe that they can't make suggestions to improve their work. So you'd have to question why that is. Is it something that they feel I don't have the power to do that? It's not relevant. Or is it that they feel that there's a bigger agenda at play and that they don't have the space to do that? Interestingly, we've done a lot of listening sessions with staff over the years, and consistently they will come back, and there will always be a number of people in the group who will say nobody that they've worked with has ever asked their opinion on how to improve the service. And these are people that are seeing the challenges and the problems that are there every day. And only 35% of the staff surveyed that participated in the survey said that they believed the organisation values their work. And again, that's an intrinsic motivator piece, that sense of what I do is actually adding value. And again, every staff member that we've met along the way has said if they were to ask one thing of the management team or of their colleagues, it was that somebody would just say thanks very much for the work that they do. And if you were to reflect yourself and say when was the last time anyone said thanks to you, um, everyone's experience will be different. And if you're in an organization where someone thanked you recently, then you're in a really good place, because very often something that gets bypassed, or it can seem to be tokenistic. And there is something about how do we meaningfully say thanks to people. The this I suppose the context in terms of where the organization is at is important, because anecdotal data that's out at the moment that there is a high level of burnout within the system. And we have a lot of staff that we meet that will tell us that they feel disconnected from their team, from the organisation. And the more, I suppose, burnt out people become, or the more in that space of disconnect, they begin to disconnect from themselves and they move into that autopilot role to get the job done. And it's not a good place to be, because all of this has an impact in terms of how we deliver our services, and on the individuals more so that are working for our organisations. The big, I suppose, evidence around engagement will tell us that it is one of the greatest indicators of organizational performance. And that's really fundamental. So everything from patient mortality to numbers of incidents to clinical care, everything from patient experience, reductions in financial waste, all of these are linked back into engagement and how engaged our colleagues are. And in particular, the piece about the number of incidents I think is key here, because I would have worked in complaints for a long time, and very often when you talk to staff after the fact, they would have said we could have told the organisation this was going to happen if anybody had asked us. And there's something powerful in that, and there's something really demoralising if you're working in a system and you can see the failings happening before you and nobody has actually asked the question. But obviously, there's a lot more to just asking the question. If we're asking the question, we have to be prepared to say, what are we going to do about it? Um, and that, I suppose, brings us on to this piece here. Have people, I'd say most people online have come across the framework for improving quality. If you haven't, basically there's 6 key drivers for improving quality improvement, and one of those is staff engagement. And if you're really trying to work on quality, you're looking at all of this in its totality. But these are sort of 6 of the key tips that we would see coming up time and time again in terms of how do we improve engagement with our team. And the first one there is listening. So what are we doing to value staff ideas? Asking, listening, and hearing what's important to people. And part of that, I suppose, is that there is a piece about listening, and there is a piece about managing expectations, because it's not going to be possible to fix everything, and equally it's not appropriate for quality improvement leaders to take on that role of fixing everything, because then nothing sustains. So the next piece is that action using creative problem solving. And how do we encourage people to act on their ideas? And how do we give people license to do that? Because autonomy in terms of do we have control over this comes up really strongly when we talk to healthcare staff about their work. And I'm going to touch on that a little bit later. And there is that piece about if we keep trying to put the band-aid on and fixing it in the same way, nothing will work. So we do need to create a bit of space for that creative thinking. And I'm going to touch on some techniques in a little bit that we can talk about for that. Teamwork, I think, is absolutely key when we talk about engagement. And very often there's a perception that if we have a problem, we'll give it to one person and they'll try to fix it, or we'll get 2 or 3 people working on it. But that sense of innovation doesn't often come unless you have that broader engagement. And in particular, teamwork is really key. There's some excellent data from Michael West. I know a lot of people online will have heard of it before, that will talk about if you have a real team and you can improve teamwork by 5%, you reduce patient mortality by 3.3%. So in an average sized hospital, that's about 40 deaths a year that is solely linked to how we function and operate as a team. Now, obviously, health services are much broader than the acute setting, but equally, if you're in a non-acute setting, there's an impact if you don't have a functioning team. And very simple things like have people actually met each other can have a huge contribution in how willing we are to actually work together on a challenge or an issue, or those microaggressions that can exist within our workforce can often be alleviated by something as simple as people meeting face to face. We talk a little bit about health and well-being as well, and that's looking at how do we help staff manage the emotional impact of care, and how are we looking after ourselves in all of it. So a lot of the work that we do ourselves can be exceptionally stressful at times. And for anybody that's online that's come across Schwartz rounds, they're basically conversations with staff about the emotional impact of our work. They're the type of interventions that will help support staff in a different way, but it does impact on our capacity to then engage with the service in other ways. They're things that we should be doing anyway, because we need to be minding the people that are minding everybody else. But I think when you're looking at something like this, we need to be looking to see how we're supporting staff, because if they're not in a place in terms of their own health and well-being, it becomes increasingly difficult to have something else to give to others. As they say, you can't pour from an empty cup. And that comes back to ourselves as well. And we'll always say, do we recognize our own stressors and our own triggers? Because very often quality improvement is something that we do on top of an existing workload. Ideally, it would be part and parcel of what we're doing. And it is very much, I suppose, part of the things that we're doing on a day-to-day, just in terms of service delivery. Within the current confines and pressures of the services that we're operating in at the moment, sometimes it's people's days off, it's their lunch break. That's when they're doing this work. So it's helpful to think about how are we actually looking after ourselves and minding ourselves in that space. The continuous learning and development, what training do we need, and the coaching and mentoring. So how do you prepare yourself to encourage other people to act on their ideas? And I'm going to touch on both of those in a moment, so I won't dwell on them now. Just let us know if you have any questions so far. You can pop them into the chat box and we'll keep going. And you might want to add to this list. These are some of the pieces in terms of the lived experience of trying to get staff involved. So these are the things I'm going to focus on today because they come up in nearly every session that we do. Generating interest, maintaining momentum, embedding the work in the everyday and sustaining the program. Balanced with the fatigue and more fatigue that people experience, and then create the diverse locations that people can work in. Now, I do need to say that there are some services where this type of work can be really energizing. And very often once people are in the door and they're part and parcel of quality improvement, they never look back because it's what keeps them sane and it keeps them knowing that there is hope in the system to make a difference. But it can be hard to get people into the space in the first place. And it can be hard sometimes to maintain the momentum when you've got a lot of competing priorities. So we're just going to touch on some of the suggestions that we've come across from people working within services that really make the difference. And the first piece is generating that interest in quality improvement. And very often the first piece in terms of generating interest is how are we actually inviting people to participate? And often, because of the environments that we're working within, it can be an email out to say we need A, B, and C in a room at 4 o'clock for a meeting. And people are voluntold, for want of a better word. versus volunteering, or it can be the tap on the shoulder. So there can be a perception that it's only a closed group that are invited into a particular space to work on a challenge, and it can become somewhat elitist for some people in their minds. And the reality is, for quality improvement work, a lot of the evidence will tell us that you never know where the interest is going to come from. And if I'm interested in a topic, I am much more likely to want to participate and to stick with it, versus if I was volunteered to go down to the room. And if I'm volunteered, chances are I'm going to give the bare minimum to get the job done, and then maybe move away from it. Whereas if I'm really passionate about something, I'm likely to get involved. And the example we give is, some of our colleagues were doing work on an end of life policy, and they invited the experts into the space and had maybe 10 people sitting around the table. And they found that that wasn't enough to get the breadth of experience. So they put out a question and they said, who's interested in having a good death? And they packed an auditorium full of people that had a real interest in that topic. And we would find the same with some of the collaboratives that we're involved in at the moment. In particular, there was one on pressure ulcers, and there was a staff member who wasn't a tissue viability specialist, who wasn't, from a nursing background, but had a parent, an elderly parent, that had a pressure ulcer, and they'd cared for that person, and they were so passionate about that particular topic. It really brought a different insight and a different life into the team. But if they hadn't put out the broad ask, they'd have never known who else in the team might have been part and parcel of that level of interest and commitment. So think about your invite, and think as well about how the invite goes out. Um, the vision is the next piece. So how is that vision created? So is it actually part of a strategic plan? Is it something that we've, dreamed up in an office with 3 people as something that's essential? And if it's something that is, part and parcel of our strategy and something that we absolutely need to do, then you're really upfront with people about that and saying, this is what needs to be done. But how we decide we need to get from A to B, that's the group decision. And that's the piece where people are, have an opportunity to really craft that vision together in terms of how we get there. Um, Other times you can be really, I suppose, it can be really beneficial when we talk about when the vision is being created, who can be part of creating that vision. And obviously it's much more substantial if the team is part of creating that vision about where we want to go. But there sometimes needs to be that honesty and say, actually, there's external priorities here that we need to be addressing as part of it as well. So being clear on that and clear with people on that is really useful. The other piece is the communication. So how do I hear about the work and my part in it? Is it an email? And does the invite go out by email when actually a lot of our staff don't have access to it? So it can be really useful to think about what's the best way to get the message out. We did some work recently with the Cork Maternity Services with Dr. Noreen Russell and the team there, and they found that things like the poster board or putting a message up in the staff meeting areas really made a difference in terms of people's engagement with the work, because a lot of people don't look at their emails or don't have access to them. Um, I think when you talk about passion, that sense of interest in what's in it, I'm going to touch on that a little bit for a second, and I'm going to come back to a question from Valerie in a moment as well. I suppose one of the things that we talk about, that passion and what's in it for me, is the work from Simon Sinek. I don't know if you've come across this before, but Simon Sinek talks about the golden circle, and he talks about a lot of the time we're focusing on the product. What do we need to do? How are we going to get there? And really the key piece is, why do we want to do this work? And being really clear about the why. Um, and the question that's come in there is just, how do you manage the passion for the why and the strategic direction or planning for the organisation area if they don't align? And that's a really difficult one, in the sense that sometimes the strategic direction is the piece. I think if it's a thing and a question that they don't align, we need to ask the question, why is that? And is the strategic direction actually meeting the needs of the people who we are working to serve? And that's the first question that you'd ask. And if it is the case that this is the strategic direction, there's a piece about being really upfront with people about that, um, and then seeing what else they're trying to achieve or what else people are interested in, and seeing, is there space for that as part of that conversation, or is it a different piece? because obviously the strategic direction is key in terms of how we do our work. But we need to make sure, obviously, that that is always going to be rooted in the needs of the people that are using the services. And that why, when we talk about that why, that motivation, everybody's why is going to be a little bit different. So for some people, it'll be the patient story. For some people, it'll be the sense of achievement when I've worked on something. But I think the key thing in that is being really clear on what the direction of travel is, what is our vision, and sometimes having that conversation to tease out, are there differences? Why are there differences? Um, can sometimes bring people a little bit closer together in terms of what they want to achieve, or you might suddenly realize actually there's space for both of these, but maybe they need to be managed as part of a slightly different process, or maybe they can be managed together. I think that that's worth a look. That clip is worth a look at if you haven't seen it before, because it does definitely refocus our minds in terms of that piece about that intrinsic motivator for us, and being aware of what motivates each of us. Some people, will be very upfront with that, others won't, but it can be really helpful to keep in our minds, because we do get very stuck in the process and the product, and that's not the bit that keeps us sane. We'd always ask people, at the start of a session, why did you become a healthcare employee? And very often the reason they joined the health service was because they wanted to make a difference. They wanted to change lives. And when we ask them, why are you still a member of the health service? It's things like, well, I have a mortgage and I have 3 children at home, and I don't have that same flexibility or that same motivation, until you start to strip it back. And then there is that realization that I still have those same motivators. I still want to make a difference, but you can lose sight of that in the day to day. And we often lose sight of that as the organization changes and develops. That can sometimes get lost. Okay, the other piece I suppose to think about is you will have people that will be the early adopters, and most everybody that's done any type of a quality improvement program will have seen this diffusion of innovation theory. And it's the idea that you will have people that are really there, they're ready at the start, that they're willing to take on a problem and to run with it. And then you'll have people that will wait for that I suppose, visual proof to see something working. And then you'll have people that will be a little bit slower coming on, and then the ones that are sort of stuck in the mud. It can be important, I suppose, to think about why people might be stuck, the laggards, or the late majority. And is it that they don't trust the idea, or they're not behind it, or it's just not of interest to them? Um, while not getting too hung up on it, because if you really want to make a change, sometimes you just need to get going. And if you have an interested group, there's a concept that we work with the principles of frontline ownership about working with the willing. So you want to really work with those people that are willing to work with you, unless of course somebody within that group of the late majority or the laggards is fundamental to progress. And then obviously you can't move forward without having a conversation with them about what's important to them. There is a really good clip. It's the first follower, leadership lessons from the dancing guy. It just takes a few minutes to watch it, but if you haven't seen it before, it's definitely worth a look, because it talks about you can have a leader who's there and who is front and center, but until they have that first person to follow and to step with them and give people that confidence, they're very unlikely to progress to what they need to progress to. And that I think is key when it comes to quality improvement. You need more than one person championing an idea, because we don't move forward unless we have others with us. And that conversation about I and we comes up really strongly in quality improvement. When you hear people talking about my project, I did this, I did that, you can see faces deflating around when they realize that actually no, that there was much more than one person that made things happen. And very often things don't sustain if it's just reliant on one person. I think it's probably worthwhile to focus on as well what's within our control to change. We use some really good techniques called liberating structures when we're looking at quality improvement work. They're engagement techniques that can actually help us change the conversation about what needs to change. And one of the interesting things about that is it helps us sometimes focus on what's within our control to change and what's completely outside of our control, and then are there things that we can influence. And very often what you realize with the team is that you will have some people will have a really clear picture. I can completely control that. That is something within my gift. And sometimes that's because of their role. but sometimes it's because of an attitude, and they're called the positive deviants, the people that will make it work given the same set of circumstances as in team A and team B. Team A will find maybe a way of making it work and team B maybe won't. So it's really helpful to look to see who are the people that can maybe make it work. But also as well, it can be really useful to get a sense from your team about what do I feel is within my gift to change. And one of the things we found in healthcare is sometimes there can be a sense of what's called learned helplessness, because very often people have been in positions where nobody has ever asked for their opinion. When they've asked for their opinion, they've never actually given them an opportunity to work on something. And sometimes that can mean that when somebody is asked for their opinion the first time, they're really shocked and they don't feel that they have any power or authority or autonomy to make a change. So it can be really useful to have a conversation with people to get a sense of, do they feel they have the autonomy to make a change? And if they don't, why not? And helping people realize actually that is within your control, you know, and challenging sometimes some of the perceptions that are there. And there can be huge perceptions around, oh, there's a policy for that. And there might never have been a policy for it, but it can be our perception that it's always been done this way, so it must always continue this way. And again, that can put barriers in our place that are actually the invisible barriers, but they're so strong they stop us from moving forward. But actually, when we pull them apart, there's no need for them. So it's really useful to have those conversations with a team working on a quality improvement piece and focusing then on what's actually within our control to change rather than all of those things that are completely outside of our control. Um, and that sense of focusing on the 15%. So there's a liberating structure called 15% solutions. And it's that idea that there might be one thing that I can do to make a difference. Somebody else might work on something else. And then together we have the collective change happening, but that we don't all have that capacity to control everything. I think the piece there in terms of the meaningful opportunities to connect can be key in this, because again, in those conversations, suddenly you can have somebody that might bring the group to a different place, or can maybe through the conversation or through the discussion, there can become a realization that actually together we can both, maybe support a change here. Whereas in isolation or working by ourselves, we don't, or we can't do that. Um, do let us know again if you have any questions, and I hope this is making some sense to people. Obviously, we talk about listening to people as a key part of quality, and in particular when we're trying to change things. It can bring its own challenges and barriers. And often, do we have to ask, do we listen to hear? Equally, if you're very attached to something, there can be an innate desire to defend or challenge, or you can have a bias. Probably one of the challenges, but also I suppose one of the great powers of quality improvement is the fact that we've all had experience of quality improvement in some shape or form in our past work. That can be really positive in the sense we can bring huge breadth of experience to things, but it can also mean that we can bring bias. And because maybe something didn't work in a particular setting, we're automatically crossing it off the list. And we had a really, I suppose, frank conversation with a director of nursing and midwifery in a service a few years ago. And they talked about somebody coming to them with an idea. And their automatic, half the idea was just about to be voiced, and they sort of said, no, we don't have time for it. And the director of nursing spoke of that moment of realization as they watched the person's face and realizing that that person was not going to voice another idea in the near future ever again, because it can take a lot of courage for somebody to come with an idea, and sometimes one of the things is if you're the person that's hearing those ideas, that capacity or ability to pause and hear it and then see maybe where it goes through discussion can be really useful, because through some questions or through a discussion, maybe it might, mold into a different shape or form, or maybe it's a really good idea. And there that the time for that conversation, while it can seem to be really precious and maybe we don't have it, can sometimes be really, really key to creating something that's really powerful. So sometimes stopping our own biases or being aware that they're there can be essential as part of that. And knowing as well that people's perceptions of circumstances can be really different. And just because it's someone's perception, it may or may not be true, but if someone has the perception, then it's something that needs to be tackled and addressed. And being gentle with yourself in all of this, because sometimes when we're involved in quality improvement work, whether it's as a member of a team or whether it's a lead for a team, you're in a position where potentially you're really invested in this. And sometimes it can seem like can't get this done fast enough, or there's a lot of negativity around this. And actually, what we need to strip it back and say is, well, we're in a place where we're trying to make a difference, and it's one small step at a time to make that difference, as opposed to that desire for perfection and expectation that we have for ourselves. And I think I think each of us as part of a team has a role in supporting others to be heard, because often we will sit back and observe a conversation and observe an idea coming forward, and then it gets lost, or it doesn't translate into something. But but that membership of the team can mean that we can actually have a word of encouragement for somebody, or can have a conversation with them about this particular piece of work, to make a difference. There is, touched on the piece about mortality earlier on in teamwork, but there's some really good evidence at the moment, and there's a really good YouTube clip by Dr. Chris Turner that talks about the impact of rudeness. So whether it's an idea cut short or somebody feeling that idea was laughed at, can actually be really can have a huge impact on an individual. And the conversation with Dr. Turner, he talks about the impact of rudeness in terms of our capacity to do our job. So there's a 61% drop in bandwidth if we witness rudeness. But the piece I think is really key from a QI perspective is that if you witness somebody being rude to a colleague, you're 50% less likely to help a colleague who asks you for help immediately after witnessing it. And if we're relying on that discretionary effort of staff to get involved in quality improvement work, and we're working in an environment where people aren't kind to each other, or our work isn't, I suppose, underpinned by that sense of civility in the workplace, then you're much less likely to have that discretionary effort, and you're much less likely to get that engagement from your colleagues. And it can also lead obviously then to medication errors, or not picking up on things as part of our day to day. But I think that 50% drop in our willingness to help others is really interesting, and quite stark. But it is helpful to know that if the environment that people are working in is collegial and we get on well together, then we're much more inclined to get on and to see how we can support each other. I think this diagram of the "sure glad the hole isn't at our end" sort of sums it up. It's that sense of how we can support each other, and building that sense of team is really key. And being aware of what's my role in that. So am I a team member? Am I seen as the official team lead? And that will have a different type of a connotation for what type of role you might take up in some instances, and in others it won't, because people and leaders can come for anyone. I think the types of questions that we see is, have people met each other? Do we know what we're trying to achieve together? So is everyone clear on what we're trying to do? Is there that sense of respect, and do we treat everyone the same? Being aware of how people can actually communicate, and in particular, if you're in a leadership role, thinking about, are you visible to people? So have you met people on the ward? Have you met people within a community setting? And it can seem absolutely crazy, in terms of how do we actually get people into that space, um, and how do we make that time for ourselves? But actually, that visibility and that acknowledgement of the work that people are doing is a real motivator for people. And the other piece as well is, how can you encourage people to get to know each other? Just seeing there's another question coming in there. Should staff or teams be given protected time to engage in quality improvement activity? My instinct is always yes, in the sense that if you have a team that is working, and I'm not sure it's protected time, but I think quality improvement should be built into all of our roles and functions. So whether you call it protected time or you'd call it just part and parcel of our work, as part of our work, then I think that is, I suppose, quite similar in a lot of ways. If and we use the example at the moment that a lot of us feel like the building is burning down around us, and we're there with one bucket of water at a time trying to put out the fire. and we're all working really hard with the one bucket of water at a time to put out the fire. But if we could free up the time of 2 staff members to go down the street and turn off the gas supply, um, then we put out the fire. So if we continue to operate in the service in the same way we're doing it at the moment, where quality improvement is often an add-on, add-on to our jobs, very often what you see is people have the energy for one piece of work or one project, and they will have the interest, but they may not have capacity due to their circumstances or work, to continue that level of engagement. And we shouldn't be expecting it of people either. It should be part of their work. But if we're doing that and we have that protected time as part of our general day-to-day work, then we change the dynamic and we spend less time dealing with problems, because we're alleviating them. The service becomes much more efficient, so we begin to see a greater number of patients, and it takes the pressure off. So I think that we have to question, can we afford not to give people the time to actually do this work? And in particular, when you're in a leadership role and you're looking at the teamwork piece, key part of that is making the time for this type of work, and how do you support people to actually get to know each other and to meet and to have these conversations. And it can be exceptionally difficult, especially when people are on shift work, but things like team huddles or WhatsApp groups or innovative ways to get people to meet and to converse. um, Once they've had that initial first meeting, you can look at some of the technology to support our ongoing engagement. But that face to face is invaluable, and we need to make time, I think, for that as part of this. Um, and I'd say don't underestimate the power of a cup of tea. It's really important, and it makes a huge difference, to people once they've had an opportunity to connect in an informal setting sometimes, because the conversations change and you get to know people's interests, and that can spark a conversation, which can then mean that actually there's a degree of trust there. And there's a whole lot of evidence around the impact of psychological safety and psychological trust in a work environment and what that can do, in terms of how we operate and how we connect in with each other. And all of those things then improve how we provide the service. The piece about maintaining momentum, this comes up time and time again as well, and again it's linked into the time. If I don't have the time to do the work, you're not going to maintain the momentum around it. But the first thing I'd say to you as well is it ownership or buy-in? And we talk about people owning the work, so having that autonomy to do the work. And sometimes that's a conversation with the leader, and the team, to be able to say, and when I talk about the leader, everybody within the team can lead, but often there is a delegated, manager or person that is seen as sort of the gatekeeper in terms of releasing people to participate in this. And are we encouraging people to actually take up their role fully? Or, does that leader hold on to that control and say, actually, we're going to prevent people from moving this forward, or we're going to support them, but we're only going to give them a certain amount of scope to do it, which means that they don't have the skills or the resources or the tools to really engage in the type of quality improvement work we want them to do. The we versus I. So is it our work? Is it your project? Is it an I piece? Can the team feel that they're able to name what's not working well? And again, there's sometimes a need to create a sense of permission within the team, that actually we can name what working well, especially where you have people within different grades. No matter what way we look at it, within the health service, the control and command leadership style is the most prevalent leadership style. And while that works, if there's an emergency situation in the morning and somebody needs to be able to follow a process or a protocol for quality improvement work, it won't help sustain quality improvement. So we need to be able to voice what's not working well. We need to be able to understand what's our role as part of it. Does everybody have a say? And are people's voices heard? And again, sometimes we need to actively create a space for that, because sometimes there's a perception, well, I asked everybody, but nobody came forward. But you have to go beyond that to say, do people feel safe to actually voice what they're thinking? And I participated in a meeting, quite recently, where there was conversation about conflict, and past conflict within a team. And somebody said, I don't think we should be dwelling on the past, we should be moving forward. And at the end of the meeting, somebody said, I didn't feel comfortable to voice my thoughts on this. And I thought it was a really brave thing to do. But the one comment by a particular person silenced others from participating. And while much of the conversation was about we want everyone to participate and to share, people didn't feel safe to actually to voice what they were feeling. So thinking about that really clearly can be key for this, because you might end up finding that the solution could come from somebody in another way, if they have a greater opportunity to have a say. And also, how involved do people have that in terms of finding the solution? And most important, how do we say thank you and celebrate success? Everything from a visual display board to notice boards to an email to a staff newsletter, whatever it is, can be key for keeping people motivated for this type of work. And also thinking about that face to face. Thank you very much. Notice the work that you've been doing. It's been really, key to the change here. That can make a big difference for somebody. Even when things don't go to plan or they take longer, having that opportunity to say thank you can actually keep people going, because sometimes that sort of work will have a big impact on my desire to stay involved in it. As that, does somebody recognize the work and the effort that's gone into it? We talk about power bases, and people will have maybe seen some of this before, but a lot of people will link in terms of engagement. A lot of people will link in based on identifying or their respect for the leader or the person that's actually driving the work. And ultimately you want the team to take it on and drive it, and a part of that is that mutual respect of everybody. But very often what we find is that people in a healthcare setting often rely on the delegated authority, so that legitimate power. So it's helpful to think about how do we actually connect in with people that are part of the team, and how do we support each other to connect with each other. The other thing as well is to think about how do we influence people in this work. So there's a really good clip. It's the science of persuasion, and it's based on Cialdini's work. But again, the language, the invite, the how do we actually get people into that space can be helpful to think about. And there's one really good example, and they talked about near miss forms in one particular hospital that a colleague of ours worked in, and they changed the language of the form from near miss to a good catch, and they improved the reporting considerably because of the change in language. And it was as simple, they didn't do anything else, just change the language. So how we frame things can actually have a huge impact in terms of how we influence people, and that's worthwhile for your team to think about in this work. The other thing as well is when we're having some of those conversations in QI, how we do that can be key and really important. So using things like Edgar Schein's humble inquiry, you've probably heard it mentioned if you're a usual QITalktime participant, but there's some really good suggestions there for raising ideas in a really gentle, safe way so that people don't feel that they're being challenged. And there's some good thoughts on that. And there are other, I suppose, for people that are part of a QI team, thinking about how you have those conversations and how we actually delegate autonomy if you're in a leadership position can be really important as well. And there's often a really valuable conversation to be had at the start of a quality improvement project about the roles and what are our expectations and how are we all going to support this particular piece of work, so that people feel that they have that capacity and that power to get on with the work, but they also know really clearly if they're running into problems or they need to learn how to navigate or negotiate through the system, that they can contact or who they need to contact about that. We're coming to the end very shortly. I suppose just these are some of the pieces that really would stick with me from some of our work. The communication is key. In particular, the use of a picture or a story can be much more effective than some of our traditional forms of communication. So thinking about your story, what inspires people, and also the data, quality improvement data can be key in terms of engaging people. So knowing the people that you're trying to engage, knowing what's important to them will help you shape how you can communicate, and how you can design the vision. These are the principles of frontline ownership. And again, things like going slow to go fast. This work can take time. Inviting the unusual suspects, working with the people that want to work with you, knowing that participation is voluntary, that sense of nothing about me without me, knowing change can spread in multiple ways. It doesn't always need to come from the top. It doesn't always need to come from the frontline staff, as they'd say. You'll have people working within an environment who'll have an interest, you never know where it's going to take you once we give people that space to really participate. There will be times when you need to make the invisible visible. So when we need to stop and say, okay, this isn't working, or there's a challenge or an issue here, and how can we go about doing that? And then acting your way into, a new way of thinking. So that can be really, really useful. That sometimes we wait for perfection. We wait till we have all the answers, or we wait till we've done, a stakeholder analysis that's 15 pages long. Just sometimes we need to stop and say we're going to start, and get going, and then use your PDSA cycles or use the techniques that are there to support you. Um, and using some of the skills that are there and the techniques that are there. So these are some of the liberating structures I touched on earlier on. There's also some really excellent resources from the Q community. And I think just here, these are ones that we would find most useful in terms of everything from strategic planning to sharing the learning, sourcing help, or bringing to pattern, bringing behavior to light. And there's a really good app that's there that you can use, and these are all free. They're really easy to use. The biggest thing is just taking the step and starting. But they can be really good to shake up a conversation or to have a conversation in a different way. In particular, if it's a really embedded challenge within your organization, it's useful to think about that. Um, and then just the motivating for excellence. So most people will be motivated if they're treated with dignity and respect, if they have the tools to do the work, and that somebody notices and says thank you. And they're really key fundamental pieces. Often a lot of engagement work comes back down to the basic fundamentals. And I would say to you that there are lots of supports and resources available to you. There is a leadership skills toolkit for staff engagement. It's on our website, staffengagement.ie. The Q community, creative approaches to problem solving. So some excellent resources from the King's Fund and the co-lead project. So the collective leadership project, there's a co-lead toolkit that's now available online, and there's some wonderful resources in that, along with our own resources. There's some amazing tools there to support people. And then there's some really useful talks that we've come across. So the power of vulnerability. If you Google psychological safety, Simon Sinek Golden Circle, and Dr. Chris Turner on civility, you'll see some really useful resources, and it just gives you a different insight if you haven't seen them already. And we'll leave you with just when you believe anything is possible, anything is, and connecting in with your own why and helping others that we're working with connecting with their why. So that's it for today. If people have questions, just let us know. You can pop them into the box or you can email us. In terms of the next webinar, it's on Tuesday the 18th of February. And just to say, it's one that's live from Dublin Castle, where we have the All Ireland Schwartzrands and QI conference, People Make Change Happen. And that QI Talk Time will have a mix of speakers from across a broad range of QI and Schwartzrands. So we're hoping it'll be a really, really positive event. And we hopefully will see a few of you at that event. So thank you very much, everyone. We'll chat to you all soon.